Do you sometimes feel like people are watching you, even when no one is there? Or maybe you've heard a voice calling your name when the room is empty. What if I told you these experiences might not be in your mind alone, but could be linked to something happening in your body, like your brain or hormones? That's what happens in psychotic disorder due to another medical condition. It means you show signs of psychosis, like hallucinations or delusions, not because of a mental illness like schizophrenia, but because of a physical health problem. Imagine your brain is like a smartphone. If the battery is damaged or the software is glitching, the phone might start showing weird pop-ups or freezing. Similarly, when your brain is affected by an illness like epilepsy, a brain tumor, or even severe infections, it can glitch and cause psychotic symptoms. So it's not all in your head. It's literally because your head or body is dealing with something real and treatable. What actually causes this disorder? Think of it like this: your brain runs on chemicals, electricity, and healthy body systems. If any of these go haywire, your brain might misfire. For example, did you know a thyroid gland that's too active, called hyperthyroidism, can make you anxious, confused, and even make you see or hear things? Or that a stroke or head injury can change how your brain processes reality. Other causes include brain tumors, epilepsy, Parkinson's, disease, multiple sclerosis, or even high fever from infections like meningitis. Even some autoimmune diseases, where your body attacks itself, can lead to this. It's like if your internet router is damaged, your Zoom call might freeze or show weird images. The problem isn't the computer, it's the connection. In the same way, the psychosis is a symptom of a deeper physical issue. So how do you know if it's this disorder and not something else? Let's play detective. Suppose your friend suddenly starts shouting, "They're watching me through the TV, and they never acted like that before." That's a red flag. Key symptoms include hallucinations, seeing, hearing, or feeling things that aren't there, delusions, firm beliefs that aren't true, like thinking you're a secret agent, disorganized speech, jumping from topic to topic with no logic or strange behavior, acting confused or frozen. But here's the twist: these symptoms must start after a medical condition appears. For example, if Aunt Mary was perfectly fine until she had a brain infection, and then started seeing bugs on the walls, the timing points to this disorder. Unlike schizophrenia, where symptoms grow slowly, here they often come on suddenly with a clear physical cause. How do doctors figure this out? It's not a guessing game. First, they ask, are you having strange thoughts or experiences? Then, they check your body. They might do blood tests, brain scans like an MRI or EEGs to check brain waves. Imagine your car making a strange noise. A good mechanic doesn't just guess. They check the engine, oil, belts. Same with your body. If tests show a brain tumor or chemical imbalance, and the psychosis started after that, the diagnosis is likely psychotic disorder due to another medical condition. Treatment: fix the root problem. If it's a thyroid issue, medicine can balance it. If it's a tumor, surgery might help. Sometimes, short-term antipsychotic medicines are used to calm the mind while treating the body. And guess what? Once the medical issue is treated, the psychosis often goes away, like fixing the router fixes the Zoom call. Can we prevent it? Not always, but we can reduce the risk. Think of it like car maintenance. Regular health checkups are like oil changes. They catch problems early. For example, if you know you have epilepsy, taking your medicine regularly can prevent seizures that might trigger psychosis. Managing chronic illnesses like diabetes or high blood pressure also helps protect your brain. Avoiding head injuries by wearing helmets or seatbelts, that counts too. And if you or someone you love suddenly acts confused or paranoid, don't wait. Get medical help fast. Early action is like spotting a small leak before it floods the house. Prevention is about listening to your body and not ignoring big changes in thinking or behavior. Scientists are learning more every day. One cool advance: they now know some people develop psychosis because their immune system attacks the brain, called autoimmune encephalitis. A few years ago, this was often missed. Now, doctors can test for it and treat it with immune therapies, like calming the body's friendly fire. Another exciting area is using AI to analyze brain scans and find tiny changes linked to psychosis. Imagine an app that helps doctors spot early signs before they get serious. Also, research shows that treating the medical cause quickly leads to better mental recovery. So it's not just about antipsychotics anymore. It's about healing the whole person, body, and mind.